I'm Dr. Paul Butler. I'm originally from Iowa, and I did my education in the Des Moines area originally. I started at Drake University for undergrad and stayed in the state and went over to the University of Iowa. I'm a big Hawkeyes fan. Then did some further training with residency up in Grand Rapids, Michigan, and then foot and ankle reconstruction fellowship up there as well. How I ended up coming across the medical profession is just my love for science and anatomy growing up, and really got me involved in the medical profession going forward. Orthopedics in general has always been an interest. Maybe it was something as a young person where I broke a lot of bones just because I was an active person and was rambunctious. And so I was very familiar with the orthopedic clinics locally over in Sioux City. So that maybe kind of spurred some of it. But then from there, I've always been a hands-on person, and then foot and ankle in particular, the complexity of foot and ankle. There's a lot of different facets of foot and ankle. There's trauma, so broken bones, torn tendons, but then reconstruction with arthritis and deformity. And so there's a lot of different aspects, and everybody's foot's different. And so there's nothing that's really cookie cutter. Everybody's different, and so it's how can I make each individual person better. And so it's a little bit of a puzzle each time I have a conversation with a patient, which is enjoyable for me. It's a challenge, but I also think it's a unique opportunity to help each patient individually. So orthopedic surgery, foot and ankle, how we go through our training is that we go to medical school. And so the University of Iowa Medical School, we have our 4-year degree from over there. And then you go through orthopedic surgery residency, which is its own 5-year program. The big thing with that is that I think that it puts things in a lot of perspectives. Is that from a foot and ankle reconstruction, as I always tell people, that the little kid song, the knee bones connect to the hip bone, and everything is correlated. And so being able to have that connection from the ground up, I think is big for people, because it not only puts things in context from a foot and ankle perspective, but then it also helps tie things to other ailments within the body, whether that be fracture care or whether that be something from a deformity or reconstruction standpoint. So I think the big thing is that from an orthopedic training perspective is that it does allow us to tie everything together and treat the whole person and the whole body. My patient approach, I think the big thing is identifying what each patient needs and what their goals are. And so everybody's different, whether it's a young person trying to get back to high school athletics or club sports, whether it be somebody that's an adult that's trying to do recreational sports, or somebody that's older that just wants to play with their grandkids or be able to be functional within the community. And so I think the big thing is identifying what each person needs and then how we get to those goals. A lot of times we can start with easy things first, that are the non-surgical options, and those work well for a lot of people. But then if those opportunities don't work for people, then we definitely have other surgical solutions that we can essentially ramp up to get people to where they need to be. I think the big thing from trying to determine who to see as your provider is trying to find that connection and who you trust. Asking questions, I think the big thing is I think it's always important for the patient to understand what's going on. And so not only whether you have a question about what the diagnosis is or why you're doing what you're doing, but having that comfort level is important, because I feel that whenever I go into a patient's care, whether it's operative or non-operative, is that we're embarking on that journey together. And so it's having that connection and having that trust level is important. The questions that were commonly asked is, do I need surgery? Because patients come in here, they potentially have seen other people, they've seen primary care providers, they've talked to friends, family, been on the internet, and so there's a lot of information that's out there. And so people come in with a lot of preconceived notions, and they say, hey, do I need this? And I think the big thing is that everything is in context. And so not necessarily that any of the information is wrong. It's just that how does that apply specifically to you as the patient? And then just making sure that we get you the correct treatment going forward for you. Within orthopedics, the thing that I'm the most passionate about is seeing people get back to the things they enjoy. I'm an active person. I like being outside, whether it be going for walks with my family, with the dog, just hanging out, walking over by Saylorville, just being outside and enjoying life. But that what also carries over into orthopedics and seeing patients and trying to figure out, okay, what do they like and how do we get them to that goal? Because I always say that orthopedics we deal with quality of life, not quantity of life. And so how do we get that quality back for our patients? And that's really what I strive for on a day-to-day basis. What I really enjoy about the Ankeny community is that it is a community. And everybody thinks of Ankeny as potentially a suburb of Des Moines. And I think the neat thing is that Des Moines is a bigger city and there's a lot of resources available, but Ankeny is its own community. And so we have our restaurants and our parks and our trails, the schools. And what I find is that my wife and I, we live up here, and when we go out and about, we go out in Ankeny. What I like about being up here on the north side of Ankeny is that we are able to provide a service to people locally. And so for a long time, there necessarily weren't surgical services on a consistent basis up here. And Ankeny is its own town. And so people have the opportunity to be able to come here not only from Ankeny itself, but from the surrounding area and be able to get those resources and provide it to a population base that lives here locally and they can get their care here locally.